So yesterday, we started discussing the antipsychotic drugs. Before mag-continue with the atypical drugs, let's have a little review first about what is psychosis. So remember, when you say psychosis, there is detachment from reality. There is the loss of contact of reality. And then we have two broad forms of psychosis. We have hallucination and delusion. So when you say hallucination class, it involves your senses. You can feel something that ikaw rin nakabalo, ikaw rin nakakita, ikaw rin naka-feel. But when you say delusion, it has something to do with the belief. The person is believing something na it is false and it is not shared by other people. Now, the most common form of psychosis or most common na sakit involving psychosis is the schizophrenia, wherein there is clear sensorium, meaning the person or the patient has clear sensories. However, there is a marked thinking disturbance. So sa schizophrenia, the problem really is the way the person thinks. There is a problem with the perception and the way na mag-communicate ang patient. So we have two types of symptoms of schizophrenia. The first one is positive na symptoms. That is where the person hallucinates or naa siya'y delusion and restless. While sa negative symptoms, mostly we cannot really conclude immediately if the person has schizophrenia if negative ang kanyang mga symptoms. Kasi the patient is experiencing like loss of motivation, loss of interest sa iyahang mga usual na ginahimo, and there will be problems with like kanang sa social life niya. So naay social withdrawal lang iyahang mga ma-experience, but included na siya sa symptoms sa ato ang schizophrenia. Now, we have two types of drugs na ginagamit natin for psychosis. We have the typical and the atypical. So yesterday, we have discussed what typical antipsychotic agents are. They can be also called as neuroleptics, or they are the first generation na antipsychotics. They are the first generation, but they are not the first line drug. So the reasons why dili sila ang first line drug, first, there will be increased incidence of the extrapyramidal symptoms. So, na-mention na to ang extrapyramidal symptoms yesterday. We have the dystonia, and then we have the akathisia, the pseudoparkinsonism, and the last one, which is the irreversible EPS, is the tardive dyskinesia. So, pasunod na siya kung based sa exposure sa patient, kung kanusa sila mugawas. So the reason why there will be extrapyramidal symptoms for the typical antipsychotics is because of their mechanism of action, which is the blockade of the dopamine receptor only. So ang ilahang activity is concentrated on the dopamine receptor, wherein may effect siya sa muscles. So mo na siya nga ang EPS, mostly muscles ang iyahang mga signs or mga naapektuhan. That's the problem with our typical antipsychotic drugs. Okay? So questions, class? About the typical one. So since dopamine receptor lang ang iyang activity, positive symptoms lang iyahang ginatreat. And then we have the second generation antipsychotic agents. They are our newer drugs, and they have the advantage of lesser incidence of the extrapyramidal symptoms. So the reason is ilahang activity is actually more on the blockade of the serotonin receptors. However, they also can block but weakly yung ating dopamine receptors. So they are our first line drug. However, ang disadvantage of these atypical agents are is more expensive sila and naa sila yung sariling complications. So since these drugs can also block the muscarinic receptor, they have anticholinergic effects, and they can also block some adrenergic receptors. That is why, as you can see on the screen, we have there the hypertension, the hyperlipidemia, abdominal fat, and the insulin resistance leading to diabetes. So I had introduced sa inyo yesterday ang mga specific nato na mga typical antipsychotics. This afternoon, let's have the atypical drugs. So again, do not forget the atypical drugs are our newer antipsychotic agents. And actually, their structure is still derived from the atypical ones. So we have here the ring analogs of the phenothiazine. So remember, the phenothiazine is an example of a typical or a neuroleptic drug. So ang ingon ako gay na ang structure lang sa atong atypical drugs gi-pattern din ha. Pero they have advantages. So na mention na nako ang mga advantages gaina. So we have here the loxapine, for example. This is an atypical drug, and then I have mentioned sa inyo the prototype drug is the clozapine. Sa brand name niya kay Clozaril. So this is proven na effective even sa mga chronically ill patients nato na nag-respond poorly sa ato ang mga typical drugs. So, di ba, pag neuroleptics, they are our typical drugs. So, clozapine really is a very effective antipsychotic drug. However, there will be times na clozapine will be discontinued abruptly. Diba, yesterday, nag-mention ko na itong mga antipsychotic drugs should not be stopped abruptly because kailangan i-titrate sa ang dose para wala yung mga withdrawal symptoms. But for clozapine, there will be times na gina-abrupt siya og stop because of its adverse effect, which is the severe agranulocytosis. So remember, pag ang word class nag-end sa cytosis, it means there is increased level or increased amount. Kabaliktaran na siya sa words nga nag-end sa pinya, P-E-N-I-A. Okay? Like neutropenia or thrombocytopenia. Baliktad na siya. Pag nag-end ang word sa pinya class, it means lower na level or low na amount. So in this case, pag a person is like taking clozapine, gina-monitor ang iyahang agranulocytes. So pag mayroon kang agranulocytes, these are the white blood cells without the granules inside. Kasi itong mga white blood cells, they are divided into two. The granulocytes and the agranulocytes. Ang granulocytes class, mauna atong basophils, eosinophils, and neutrophils. And then our monocytes and the lymphocytes are under the agranulocytes. So pag sa clozapine, mauna ang nag-increase ang agranulocyte. So we don't want that na ma-experience sa atong patient that they will have too much amount of their white blood cells. So muna siya nga gina-stop siya. However, clozapine is a very long-acting drug na even if you stop it abruptly, it can still block the receptors up to 6 months after the abrupt na pag-stop. Okay, again, severe agranulocytosis pero actually clozapine still remains a very effective drug, and that at the same time, even for depression, you can use this. It can reduce suicidal risk for our patients. It can actually reduce the suicidal ideations of our patients. And then we have another drug, Zyprexa or the olanzapine, which is a more potent antagonist at the D2 receptors and the 5-HT2A receptor. So both dopamine and serotonin receptor. But at just like all the atypical antipsychotic drugs, naagihapon ang mga complications because of the blockade of the adrenergic receptors. So there will be weight gain and hyperlipidemia because of the decreased lipolysis. And then there will be insulin resistance. Therefore, it can lead to type 2 diabetes for our patients. But there will be decreased risk of having the extrapyramidal symptoms. So you will, class, if you work in a community pharmacy or even in the hospital, you can really encounter these drugs. Makita dyan ninyo sila na nagabaligya dyan og mga ingani na drugs, and they are expensive because they are atypical drugs. Mao na siya to ang reason nga usahay if naatay patient na psychotic, usahay dili sila matambalan because they cannot afford the treatment. Mao lang na ato ang problem. And then we have the quetiapine, brand name is Seroquel. And then we have other antipsychotic drugs. Risperidone is widely used in the treatment of psychosis. We have Risperdal as the brand name. And that is ziprasidone. However, we have an additional adverse effect for ziprasidone. It can cause arrhythmia or irregular na heartbeat. Okay, and the last one, which is a newer antipsychotic drug, it's called aripiprazole or Abilify. This is a favorite board exam question because it has a unique na mechanism of action. Kaya diba ito ang mga typical, they block the dopamine receptor. Atong mga atypical, they block both the dopamine and the serotonin receptor. But aripiprazole is actually a dopamine agonist at the same time antagonist. So this drug is a unique one na it can block the dopamine receptor to prevent it na mag too much action sa dopamine, but it can also cause homeostasis because it can also be an agonist for the dopamine receptor. So this is our newest antipsychotic agent and it has an advantage of lesser weight gain na incidence. So that's it for our a typical antipsychotic agent. Maulang niya kung wala na human yesterday. Questions about our antipsychotic drugs? Wala? Don't forget, class, our antipsychotic drugs is not solely used for psychosis. You can also use the antipsychotic drugs for depression to stabilize the mood of the patients due to their activity to the different neurotransmitters. And do not forget also that for mania, because mania is still included in the psychotic na disorders, for mania, our drug of choice is lithium, especially the lithium carbonate. Though the activity or the mechanism of action is still unknown, pero na siya mga effect on the ion channels. That is why it can stabilize also the mood of the patient having mania in bipolar disorder. Okay? That's it for the antipsychotic drugs. That will be the end of the coverage for your midterm exam. Again, your midterm exam is 100 points all in all that you have to study.